Hi, my name is Dr. Rahman, and I'm a consultant psychiatrist working in UK. And this evening, I got Dr. Mahibur Rahman with me. And a lot of you would already know Dr. Mahibur Rahman. He is very famous a GP and who helps, who conduct a lot of medical education activities. And a lot of you would know him from the internet and his medical education activities. First of all, I'd like to thank Dr. Rahman for joining me.
You're very welcome, Raja. It's really an honor for me to finally be able to do something with you. I've been following you for many years, and thank you for all of the work you've been doing and supporting so many doctors to get into training. It's a pleasure for me to be able to do this with you.
So this evening we're going to talk about a very important topic, which is an MSRA exam. MSRA is becoming more and more important, especially in the COVID time when the interviews are not happening and a lot of the specialties are using this exam to rank their training numbers. I thought it would be a really good idea to get Dr. Rahman and his take on MSRA exam, and he can give us some tips to how to go about this exam. So first to start with, I'd like to ask him, Dr. Rahman, what is a MSRA exam?
Sure. So first of all, MSRA stands for Multi-Specialty Recruitment Assessment. So this assessment is used as part of the recruitment process by lots of different specialties for entry into CT1 or ST1 specialty training. Now, it sort of first started being used just by GP. They were the first specialty. We've been using it in GP since 2007. And I think some of the data from how it was used from GP was taken to then think, okay, other specialties thought this is one of the ways to maybe help to shortlist candidates, and then maybe use it as part of the overall assessment using other things like portfolio and interview. And over the years, many different specialties have taken on. And this year, 3 more specialties. So this year is going to be 12 different specialties that will use the same exam, but in different ways.
A lot of IMGs get confused about the exam, because when they have done PLAB and they got their GMC registration and they just think that this is it and they can start training now. But when people tell them about this exam, they can get a little bit confused. So there are some very frequently asked questions about it. If you don't mind, I can go through them with you.
Yeah, sure.
So one of the common questions they ask is that, is there a fee for this exam? Do they have to pay like they paid for PLAB or they pay for MRCP sort of exams?
No, not at all. So because it's a recruitment assessment, there's no charge for it at all. It's part of the, sort of deciding who's going to get a job or not get a job. So there's 0 charge for this exam.
And the other thing they always ask is that when to sit this exam and where to sit this exam, because obviously MRCP and everything else, you can get the dates booked on for yourself and you can select a date. So is there a process to get the MSRA date as well?
Yeah, so first of all, the exam happens usually 3 times a year. So there's normally an exam some point in January, although this year it may be a little bit later. Usually it's the first couple of weeks of January. That's the main round. It's the exam for round 1 for jobs to start in August. Then there's normally a round 1 re-advert. And then the exam for that is usually around March, sometimes running into April. And then the round 2 sitting is usually around September. Okay, but you can't just apply for this exam. It's not like you mentioned, for example, MRCP. You could just apply for part 1 when the date's open. Because it's part of the recruitment process, it's not available at all as a standalone exam. Someone couldn't just book this exam. You have to first apply for the specialty that you're interested in. It has to be one of those specialties that uses this assessment, and your application has to be successfully longlisted. And then they'll give you an invitation to book. And then you sit the exam at a Pearson VUE test center. So there's like 150 of them in the UK, but Pearson VUE test centers are available in most major countries all over the world. So, people could sit this exam in Australia, in Canada, in South Africa, in New Zealand, even in places like Pakistan, India. There are centers where you could sit this exam.
And what is the scoring like? Because, like PLAB is just pass and fail. A lot of exams are pass and fail. And sometimes the score where it counts too much,
Okay, so that's an excellent question and really common one. So this is not a simple pass-fail exam, okay? This is a competitively ranked exam. So your score is based on how you do compared to other people in your cohort. And if you're applying to a specialty which is competitive, or you're applying for a specific area that's very competitive, then you could pass, but you might get 0 offers. You want to get the best score possible. even 1 mark could be the difference between you either getting shortlisted to the next stage, because some specialties use this to shortlist. A good example is radiology. So radiology, because it's very competitive, typically there's about 300 odd jobs each year. They only shortlist the top 600 scores in the MSRA amongst the radiology candidates. So let's say that you had someone who's got lots of good things in their portfolio for radiology. If they didn't get a good score in this exam, they would have no chance to get to the interview, to show their portfolio, to do well in interview. So they'll have 0 chance of getting a job, because only the top 600 will ever be called for the interview. And the interviews are going to be virtual this year. For radiology, the actual overall part of the MSRA in your ranking isn't that high. But can you see, if you don't score really well, you won't ever get a slot for interviews. So you have 0 chance of getting a job. And then 2 specialties this year, 3 if you count CAMS as a separate one. So GP, psychiatry, and child and adolescent mental health. These specialties are going to have 0 interviews or OSCEs or selection centers this year. So 100% of your rank will be based on how you score in the MSRA. Now, the MSRA has 2 papers, which are both equally important this year. So one paper is a clinical problem solving paper, and the other paper is a professional dilemma paper with situational judgment test questions. And perhaps we can talk a little bit about how many questions and the makeup of the exam a bit more, but I think you said that you had a couple more frequently asked questions, so perhaps we'll clear those first.
Yeah, I think the other confusion is that, that I understand this exam expires as well. So you have to take it in a certain time of the year, and after a certain time it expires. So that is a very confusing stats for a lot of people.
Yeah, sure, absolutely. So if you, as I mentioned, it's not simple pass fail, but some specialties do have a cutoff beyond which they consider you to have failed, and you won't even get ranked. Above that, you've passed, you get a rank, but if you've got a low rank, you probably won't get a job, or you may not get a job, okay? So someone that fails, they could resit it in the next round. So let's say they sat it in January and they failed, they could reapply and resit it. Let's say, for example, for GP or psychiatry, they could reapply and resit if there was a round 1 re-advert, or in round 2, they could resit and reapply. Specialties like radiology, ophthalmology, you see, they fill all their jobs in round 1. So they don't have a round 1 re-advert, they don't have a round 2. So if you don't get a job, you'll have to wait a whole year until the following year to apply again. Now, if you pass, like say for GP, there's a minimum cutoff above which you will get a rank. If you pass but not very well, you can't resit it to improve the score in round 1 re-advert or round 2. The same exact score will carry over, but after round 2, they delete everything, and round 1 the following year, regardless of your score, if you're going to apply again, you have to resit everything. So the score basically lasts for 1 recruitment year, which isn't the same as 1 calendar year. Does that make sense? So from round 1, that score will stay the same if you passed it, up to round 2. If you fail, you could resit it.
Okay. And one of the other commonly asked questions is that, if I'm applying for multiple specialties, for example, I'm applying for GP, psychiatry, and another one which requires MSRA. So do I need to take the exam 3 times, or 1 exam would be enough for all 3 of them?
Yes, that's a really common question. And I can see why it might be confusing for someone that's completely new to the system. So the exam is exactly the same structure for all the specialties that use it. They will use it in a slightly different way. For example, in ophthalmology, it only makes a very small percentage of your total rank. The bulk of it is portfolio and interview. For radiology, it's 1/3. For obstetrics, it's 1/4. Okay. For GP and psych this year, it's 100%. But because the actual structure of the exam is the same, you only sit it once. So let's say someone applied to GP and psych. That's very common. Lots of people will apply to both of those. Or there might be someone that actually, they really want to do radiology, but they know the numbers are low. So they apply to radiology as their main thing, and they apply to another couple of specialties as a backup. Or you could have someone that actually applied to all of them. GP, psych, CAMS, radiology, obstetrics, sexual and reproductive health, peds, ophthalmology, ACCS emergency medicine, anesthetics, everything, okay? You just sit the exam once. The same score will automatically go through the Oriel system, which you use to apply to all specialties at this level. But each specialty will use it in a different way. So for example, the same score that might get you an offer for psych or GP might not be enough to get you shortlisted for ophthalmology or radiology, where there's less numbers of jobs. GP will have probably about 4,500 jobs in round one this year. Okay, some years neurosurgery only has 20 jobs. So you see, they're only going to interview maybe 40 people. If you don't score really well, you're just not going to get an interview.
And the next question I wanted to ask you, which is more important, I think a lot of IMDs would like to know. I mean, we are recording this interview in October, and in January, the first exam is going to happen, the first MSRA, as you said. So what exactly is this exam? And I think you were explaining it earlier. And if somebody wants to do well, what should they be doing?
Great. So yeah, if we just look at the structure of the exam first. So there's 2 papers, and they're separate, but you do them at the same time. Okay. So the first paper is the professional dilemma paper. This is 95 minutes. And in that 95 minutes, you're going to answer 50 situational judgment test questions. Now, this type of question might be quite new to a lot of international graduates, but UK graduates, they will already be familiar with it, because when they're applying in final year medical school, they apply for foundation program, they have to sit the foundation situational judgment test. Now, that does test slightly different domains, and he has different types of questions, but there are some similarities. So they're at least familiar with the style. For a lot of international graduates, this might be the first time they've ever approached a situational judgment test question. Okay, so then there's a 5-minute gap. So that paper's 95 minutes. Let's say you finish that paper early. You can't carry over the time to the other paper. Like, each paper's separate. You just happen to do them one after the other. So there's a 5-minute gap. Then there's a clinical paper. So the clinical problem solving paper is 75 minutes, and there's going to be 97 questions. So you've got about 45 seconds per question. It's really quite fast paced. And this basically is going to cover pretty much all of the sort of different things that you could get in medicine. It covers cardiovascular, respiratory, dermatology, ENT, ophthalmology, endocrinology, gastro, infectious diseases, hematology, immunology, allergies, genetics, musculoskeletal rheumatoid, peds, pharmacology and therapeutics, psychiatry, neurology, reproductive, both male and female, renal and neurology. All of that is going to be, what they're looking for, because the same exam is used by multiple specialties. It's not a GP exam. It's not a psychiatry exam. It's not a neurosurgery exam. They're looking for someone that's got good, broad, general medical knowledge about everything. They want someone who's got, a little bit of knowledge about everything. And then once you get into neurosurgery, they're going to train you in neurosurgery. Once you get into psychiatry, they're going to train you in psychiatry. You see, this is just to see that you've got a good, broad-based medical knowledge. Okay, and so with the clinical paper, most doctors will be familiar with this type of question because they will have sat PLAB 1. Some of the topics for PLAB 2 will also be familiar with them. Everyone will have done medical finals. So they're familiar with the topics, but it's just a big curriculum. And so especially one of the things, doctors that have been doing one specialty for a long time, they might not have done some of these topics since like PLAB or medical school. Like when I applied to GP training, I did my GP training 2004 to 2007, and we had a slightly different exam, but we did have a sort of theory-based exam at that time as well. Now, I'd been working for a long time in orthopedics before I did GP, and then I had a gap. I did a master's. I worked in palliative care for a while. So, like, I hadn't done things like peds since medical school, or things like obstetrics I hadn't done since medicine. So, I had to go back and read a lot of these things. Whereas, someone who maybe very recently has done PLAB, they probably have read a lot of this stuff for PLAB 1 and PLAB 2 anyway. And so that part, some of it will be familiar, but some of it they just need to go into in a bit more detail, because there are some slightly different, like in PLAB 1, there's just single best answers. This has lots of different types of questions. So there are some extended matching questions, single best answers. Sometimes there are like algorithm questions where you drag the right answer into the right place, things like that. So for the clinical paper, it's really just putting the time in, practicing lots of questions, and reading to revise the different curriculum areas. For the SJT, you do need to have a really good handle on things like GMC ethical guidance, understand a little bit about the hierarchy and how teams work within the NHS, which for someone who hasn't been exposed to that, that can be a bit more challenging. And then a big part of doing well in the SJT is not knowledge, it's technique. It's understanding how to approach the different types of questions. And that paper has 2 completely different types of questions in 2 sections within the paper. So there's a type of question where you rank things from best to worst. They give you a scenario that you might see in a hospital setting or a GP setting. And then they give you a scenario, and there might be, say, 5 options, and you've got to rank them from the best option to the worst option. And then the second section, they'll give you a scenario. There's 8 options. You have to pick 3 things that go together to deal with that scenario in an appropriate way. So, exposing yourself to this type of question, but also understanding how to approach different ethical scenarios, different professional dilemmas, things that you might actually encounter in the workplace at the level of a junior doctor will help with those things.
And when it comes to the resources, what resources are available there out for the IMGs? What should they be looking out for?
So, I mean, for anyone preparing, whether they're UK graduate or an international graduate, for the clinical paper, if you want to brush up on your knowledge, 2 good core texts are the Oxford Handbook of Clinical Medicine and the Oxford Handbook of Clinical Specialties. So the clinical medicine covers a lot of the medical topics within there. So, things like the cardiovascular, the endocrinology, the sort of respiratory, the sort of gastroenterology. All of that's going to be in the Oxford Handbook of Clinical Medicine. And in the Oxford Handbook of Clinical Specialties is useful for some of the things like the derm, the ENT, the eyes, some of the psychiatry stuff, musculoskeletal, some of those things like that. That's quite useful. And I think really the biggest thing is to get familiar with questions, is to practice questions. So, when we started first teaching for this, there were no resources. We developed the first online revision bank for this exam. That was way back in 2007. And since then, each year we've tried to expand it. And so, we now got one of the biggest banks, so over 2,100 questions, including full mock exams for both the clinical paper and the SJT. But there's also, many other question banks now. So one of the things I'd recommend is if people have got time and they finish one bank, you're going to learn more by exposing yourself to another resource and doing another bank than just repeating the same questions 3 or 4 times. So that you're actually learning the subject rather than just learning that question off by heart. Okay, and for clinical, I think the more exposure and the more you get used to practice and practicing to time, so that we have timed mock exams, for example, because 45 seconds per question is very time pressured, and so you want to get used to that technique, and then you do a combination of practicing questions and reading. You can prepare. For the SJT, I think it's really important to get a really good handle on GMC guidelines, on the kinds of different scenarios someone might encounter in the workplace within the NHS at junior doctor level, on how teams work and how to deal with, and some of the stuff, it's just, you could have someone who's very experienced in another country, but it might be that the rules around things like confidentiality are slightly different. And so, some of the laws, for example, around when we have to report potential safeguarding issues, or someone in terms of sexual activity, if it's underage, what is the age of consent? That's different in different countries. So, getting familiar with things like that, because sometimes there can be scenarios related to this, that's going to really help. And I said the biggest thing for the SJT is to understand why. If you do a question and you get it wrong, you understand why is it wrong? Why is the best order the best order? And so to go through some scenarios with detailed explanation and understanding, I think that would really help.
And one of the other common things people ask is that what is the time required to actually do a good MSRA prep? Is it a few weeks, a few months? What would you recommend to? I know you would say that you might say that it's not same for everybody, but is there a general guide of how many months required?
Okay, that's a really common question actually. And there's a Chinese saying: the best time to plant a tree was 30 years ago. The second best time is today. For a lot of people, by the time they start thinking about it, they've missed the best time. The best time would have been to start a couple of months ago, all right? And one of the things I would really encourage people is please don't wait until you have been sent an invitation to book the exam, because that comes just a couple of weeks before the exam. And especially if you're working, that's going to give you very little time. And remember, it's not a simple pass-fail exam. You might pass, but you might not get a score competitive enough to get shortlisted for an interview, so in which case you have no chance of a job. Or for things like GP and psych, where it's 100%, you might get a score that will get you an offer, but not in your first choice preference. And if you want, some people, they've got young families, and so they don't really want to move because the kids are in a good school, maybe their partner's got a good job. And if you're restricted geographically, you need to get a really good score. If you are applying to an area that's really popular, like London, and lots of people really want to live in London, or I've got family and friends in London or whatever, or that's where they are now, or a lot of the big cities, because you don't apply to just a deanery, you apply to a specific area. So for example, places like Birmingham are really, really popular. okay? Whereas some other places in West Midlands Deanery, they're not as popular, but because Birmingham's a big city, you know, it's very popular. Places like Manchester. In Wales, you know, places like Cardiff and Swansea are very popular, but some of the more rural areas, like Aberystwyth in West Wales, are slightly less popular, for example. And so, you know, if you're restricted as to which areas you want, or if you're applying to any of these specialties which are really competitive, radiology, neurosurgery, ophthalmology, obstetrics, okay, then it's really important that, because it's competitively ranked, even 1 mark could make the difference. So just start as soon as you can. As soon as you've decided, look, I'm going to try for it, start. If you haven't already started and you're planning for January, you should really start this week, okay? Like by the time you see this video, you're competing with people that have already been preparing for 2 or 3 months. And in terms of how long, everyone's different, right? You've got some people who aren't working, they haven't got, you know, they're single, they could probably put in 10, 12 hours a day of study. So then they might be able to cover it in a few weeks. You've got other people who got young children, like you and I, all right? You know, we've got 3 kids each. I got a baby in the house. I couldn't find an hour to study a day. So for me, I'd need months. Why? Like, for example, on our question bank, if you just wanted to do hours, as I said, for a lot of people, they'll also do another one. But if you just wanted to cover all the questions in our question bank and do all of the mocks, our mocks have questions that are completely different to the main bank. So they're unique. So it acts like a proper mock rather than repeating questions you've already seen and you know the answer. It gives you a much more realistic idea. There's 2,100 and something questions, and we're just about to add a whole new batch of SJTs. It will take you 100 hours of study time to do it just once and read the explanations that are there. So if you imagine, like for me, someone like me, I couldn't even do an hour each day. Probably it'd take me 5-6 months. So we have people that spend a year. We have people that do it in 6 months. We have people who, you know, will manage it in a month because they've got a lot of free time and they can just put, you know, like almost full-time study into it. Everyone's different. And you all know your own situation. You know how busy you are with your job. You know, some people, if they're at work, they don't have time for any breaks. They're just, you know, if you're doing A&E or you're doing PEDS, you're full pelt. Someone else might be in a job where if they're on call, it's not really that busy. They could go to the library and, you know, do some questions on the online revision, or, you know, you can do it on the phone on ours, you know, as long as you've got internet access, you can do it on the phone. Or, you know, some people will be reading some of the notes from a textbook because they've got time even while they're at work. So if you think about hours of study, I'd say at least 100 hours of study will allow you to cover the curriculum once, to, you know, get a good handle on the ethical guidance and practice enough questions. And you want to practice probably at least 2,000 questions to have covered the curriculum. Hopefully that will help.
Thank you very much for your advice. I think you have given us a lot of tips. Is there anything else you want to add, any more advice, or any commonly asked question which you all come across which I haven't asked so far?
Yeah, so I mean, one other question I get is often some people have left it a bit late and they think, you know, is there any chance or any hope? Don't ever give up hope. It's never too late. You know, while it's, as I said, the best time was 30 years ago, the second best time is today. Just make a start. Just put as much effort as you can into it. If you don't get it, you don't get a good enough score to get the job you want or the area you want, it's still good experience. You already got a good head start then, and you can apply next time. It's fine. There's no maximum number of attempts. There's no cost to sit the exam apart from the time to prepare. And there are also resources out there that will help you cover a lot of ground in a short amount of time. So, you know, something that often a lot of people say they find helpful is we do an intensive course. And often doctors that are applying for something really competitive, you know, either a specialty or an area that's really competitive, they'll find that as well as doing questions and doing reading on their own, that going on a course will help them cover a lot of high yield topics in a short amount of time for the clinical, to cover the technique and how to approach different types of high challenge SJT scenario. So we run a full 2-day course, 1 whole day on the SJT, 1 whole day on the clinical. Within that, they also get to do lots of questions. We do time teaching mocks with detailed explanations. And then if they book the 2-day course, they also get access to our question bank, 2,100 plus questions and mocks, so that they can start reading and practicing before they come and keep it going after. So, you know, if anyone's interested, you know, perhaps you can pop a link or drop me a message. I'll send you the details. People might find that helpful. And then, you know, just like no matter how little time you've got, if your application has been longlisted, you never know. Just give it your best. It might be enough. You know, if you give it your best, you might get through. Sometimes you might not get the area you want, but you might get an area that you're happy with. And sometimes if you don't get your first choice area in the initial thing, you sometimes get an upgrade because someone that got the offer above you, they also applied to another specialty and then they might reject that job. So, give it a go anyway. All right. No matter how little time you've got, if you meet the requirements to apply, the eligibility, apply, just try your hardest. But what I would say is the earlier you start, the longer you've got to prepare better and to be competitive. But, like anything in life, prepare and you will succeed. All right.
Thank you very much for your advice. I think I give the same advice to people. They have to prepare for this exam earlier as soon as they can. Like, for example, people who are going for the psychiatry training for the next round, they should be reading for this exam right now and not wait for the right time. A lot of people think, maybe I will be shortlisted or maybe I will be longlisted or not, maybe I'll get an offer or not. So they leave it to right, as you said, right at the time when they are told that you've got to book the exam, and that is sometime too late for them to go for. So I think it's very important to prepare in advance. And also, as you said, when you're working in UK, you have, even if you are single, you still have a lot of mind power going into your work. It is always difficult to read and to study as you did in your PLAB time when you were, most of us were not working or can take some time off for PLAB. For this exam, you have to be really careful and put in your hours as soon as you can.
Yeah, one other big tip I would say is something that I often see in doctors that unfortunately don't score well and fail, is that some doctors, what they will do is they will spend almost all their effort on one paper instead of splitting it between both. Both papers are equally important. And for things like GP, there's a minimum level, okay? So, your score gets converted into bands. So band 4 is the top band, band 1 is the bottom band. In GP, you have to get at least band 2 in both papers separately to get any chance of a rank. So let's say someone, spent all their effort on the clinical paper, but they didn't really focus on the SJT, and that's something they're not familiar with. I see this very commonly where doctors will get a really high score in the clinical, band 4, top band, but they get a band 1 in SJT. Even though their total score is very respectable, that's considered a fail. They've got zero chance of getting an offer. Okay, and so it's really important, give time to both papers because they're both equally important in terms of the weighting and the ranking, especially this year. You see, historically in GP, they used to give more weighting to the SJT after the stage 3, the OSCE selection center stage. But because that's not happening, it's equally weighted this year. And so you want to give importance and give time to both papers. But within that, yes, you might give slightly more time. Like if you're already strong in clinical and you're new to SJT, maybe spend a bit longer on the SJT. But it's really important that you don't sort of just focus almost all your energy on one. You need to get a good score in both to get a competitive score and to have ultimately a good chance. And then for most specialties, so apart from GP and psych, remember this is only one part of your rank. The rest of your rank is your portfolio, your interview. And so it's really important that you also start practicing interview, start getting together things that are going to help you show commitment to the specialty, that are going to help you have a good portfolio, because that is going to play an important part in the next stage for most other specialties. It's just GP and psych where 100% of your score is based on MSRA.
Thank you very much for your time and all the tips and advice. I think it will clarify a lot of things for the IMGs who are looking for the training post and want to go for the training.
Yes, well, I'm glad. I hope it has been helpful. Anyone's got any questions, feel free to either contact me, contact Raja. You can always join. We've got a group a Facebook group for people preparing for the MSRA. Maybe we can post a link in the comments. Feel free to join that. There's free tips and advice on there. And I will actually be running in November a free 1.5 hour sort of webinar open to anyone, whether you're international graduate, UK graduate. It's going to be open to anyone that's thinking of preparing for this exam, where we will go through the structure of the exam, how the different specialties will use it. We'll do some practice questions for the clinical, some practice questions for the SJT. So feel free to contact me if you want details. We'll put the link up into the group once it's ready. We haven't set the date for it, but at some point in November. Okay.
Thank you very much.
You're very welcome.